It's not good for anybody. Wasn't insurance supposed to be for the common good? Everybody puts in a little bit, so if you need a little more, you get it. If I have a little more, I can give it. You know, that's what it was supposed to be for, not for huge profits. So we need to help them remember what their mission was. We need to do what's right and stop living for self-interest and remember that what's really good for each of us is what's good for the common good. So the public debate over healthcare reform is calling for us to speak up, with voices where we can really listen to each other.
That's right.
Right? And just like the prophets of old, to recognize that this is our moment in history, and it's challenging us to stand on the front line to save the lives and the soul of our nation. We're in a unique position to use our influence to inspire trust and dispel the fears that are being generated by those, and there are those who have a lot to lose with change. So let's follow the money, you know, let's follow the power, let's follow those places that are very happy in the status quo, hanging on by their fingernails. And you know, I hear that a lot. I hear, wait a minute, I don't want to lose what I have. But you know what? Look at what you got. The costs of plans and premiums are going up so much. And you know what? They're really on shaky ground. And we're getting sicker. We're not a first world nation anymore. You know, and so when people say we have the best health care in the world, we don't. And we need to face that. Shame on us. Shame on us. So the time is now to call in any goodwill we've ever generated in our communities to save the lives that are being lost every day, because so many of us don't have the courage that makes, and the courage to speak up, to make sure that everybody has the coverage that makes healthcare affordable. We've got to call for an end to the lies and the myths that are slowing down the road to the recovery and the reforms that we need in our healthcare system. We've got to turn this culture of skepticism and self-interest toward one of truth-telling and willingness to sacrifice a little bit. And yes, people over $250,000 of income, maybe they want to give a little more. You know, you talk to people, they're not begrudging it, they want to give more. You know, people are willing to help out their neighbors. Talk to them. They're willing to help. Nobody wants to see their neighbor not be able to take their child or their loved one to the doctor before they get so sick they need the emergency room. People want to be able to do prevention. They really do. So we must become articulate advocates of the ethical principles that will not allow special interests to compromise the will of the people, who overwhelmingly, and we know this, overwhelmingly want every one of us to have access to affordable quality health care. Missouri Healthcare for All, which is this statewide, collaborative, nonpartisan, has been listening across the state. And I don't hear anybody argue with us when we say, you know, the principles of providing access. Seems to me that overwhelmingly people in Missouri want access. So we've got to speak up every opportunity we have to demand the kind of change to the status quo where profits are more important than patients' health, causing our friends and neighbors and congregants to keep getting sicker and sicker in a nation that can well afford to do better. We don't lack the resources. What we lack is the moral vision and commitment to do what is right, and the trust that we can use our resources effectively, efficiently, and equitably. So we know what's before Congress, and you want to know something? If any of these things pass, we'll be in better shape. So let's get going. Let's not be afraid of the weeds and take this opportunity for reform and push this legislation forward now. In this session, we need reform. We got to help small businesses afford plans for employees. We've got to make sure that insurance companies have a cap on how much profit they can make so that they spend what they're supposed to spend on actual health care, so that they limit cost shifting and the growing out-of-pocket expenses that we have. And we need a public option. You know, I'm not saying no.